You are a virgin and you are doing HVS. Why? I don't understand. Why are you doing HVS? Or you are pregnant and you are doing HVS. Why? You need that, especially when your pregnancy is, let's say, above 6 months. The vagina is acidic in nature. The acidity of the vagina is because it helps in the pH, it helps to maintain the environment against foreign bacteria. So there's actually a bacteria that helps in maintaining that pH, which is lactobacilli. So it's a normal flora, is a normal bacteria that lives in the vagina. So the pH of the vagina is 3.5 to 4.5, and it also varies before menstruation. That is, before someone starts menstruating, gets to the age of menstruation, the pH tends to be higher than that 4.5, and during menopause also it becomes higher too. So it becomes higher, that it becomes more acidic in nature, but not alkaline in nature. So now, most pregnant women, they're always scared when they have discharges. You know, in pregnancy, your hormone changes. Your hormone and your physiological states of your body changes. And even the baby that you are carrying your womb also have a pressure, like the force that it exerts on your pelvis. So there tends to be discharges, because the body is trying to balance itself. So if you are having discharge during pregnancy, it's not really a problem, and you shouldn't just go and do self-medicate or prescribe a test for yourself, or just go into any lab and start telling them that they should do high vaginal swab for you. You don't really need that. You need to see a doctor to know if it's only a doctor that will now tell you if this is infection. And even if it's infection, they can now tell you to do maybe LVS, that's a low vaginal swab. So you don't really need to go and be doing this thing yourself, or just go and start self-medicating. You understand? You don't need that. And another one is because if most women, when they have infection, they're always scared to talk about it, because they feel that when they talk about it, means maybe they have multiple partners, sexual partners, so they don't feel like, even as a virgin, you can have vaginal infection, because if you are keeping poor hygiene, you would have infection, or the toilets that you're using, or even your panties and all that, you're not keeping proper hygiene. There is the fact that you keep on reinfecting yourself. So it does not really have anything to do with telling somebody that because you have an infection, you have multiple sexual. Fine, if you have multiple sexual partner, or even have one partner that is even infected, you could also get infected. But for you as a virgin, don't be scared, because you can also have it even when you are not involved in sex. So it's not something that you should worry about. It's not something that you should feel shy to talk about. But don't just go and on your own and say you want to go and start prescribing tests for yourself, or medication for yourself, or you want to go for, because you just heard that people are doing high vaginal swab, you say you want to go and do high vaginal swab. You can as well do low vaginal swab, because most people, they're like, but I'm a virgin, I'm scared that they might disvirgin me when they are taking the sample. Then go for a low vaginal swab. Since you're a virgin, then do that. But not all discharges are actually infection. Some of them are just a way of the vaginal cleaning it, because the vaginal cleanses itself. That's why it's not advisable for you to use antiseptic, to use soap and all that, all those concoctions that some people buy. You know, these some materials and some products they use for the vagina. No, they say they want to clean. No, you don't. The vagina cleanses itself, and vagina is acidic in nature. It cleanses itself. You know, so the pH is actually 3.5 to 4.5. Another thing also that I see that people also do is when they get to this thing, to a lab or hospital to do a test, then after the treatment, some of them just after 1 week after the treatment, they will now come, they will now say that they will now come, they want to do another test. Now the drug or whatever they have given them, maybe injection, is still working in the system. But now just 1 week, they will now come and do another test. There's possibility that when they do that test, they will see growth, because you just passed 1 week that you took one drug. The drug is still even in your system. It has not even finished working, and you are doing a test. So you should just give yourself a gap of like 2 weeks. Then before you now do a retesting, and it means you have to do the test with your partner again, so that your partner will not reinfect you. You understand? Then if you are a virgin that you have done the low vaginal swab, MCS and everything, your doctor has treated you and everything, Then if you still have that infection again, it means you are the one reinfecting yourself. It means you have to check your environment, maybe the toilet that you're using, maybe your panties and all that there. So you have to soak them. I don't do all those soaking overnight. And if you want to soak overnight, make sure that you are using jig, because if you are soaking your panties just without jig, you are even multiplying the bacteria. You are helping them to grow, because there's no need. You just soak your panties. There's nothing. Just leave them in the water. The bacteria will grow, and at the end of the day, you see that you are helping them to grow. So if you know that you cannot soak them with jig, wash them properly, then what you should do is that once you are pulling off, you are washing, and you are drying them properly. And if you still have time to iron, you can do iron. You can iron them also. And if you're also used to using dirty hands to touch your vagina, you should also stop that too. And when you are also bathing, don't use soap. If you want to wash, you wash from front to back. That it means from your vagina to your anus. Or if you can't, you also do that. You can also you wash your vagina with water, then you wash your anus with soap. You can wash them separately if you don't want to do this, but just make sure that the anus does not flow to the side of the vagina. The water you're using to wash your anus does not float to the side of the vagina. Just be careful. And another thing also is, don't do self-medicate, like because you have gone to do a particular test and the doctor gave you a particular drugs, and you know the name of the drug. Now tomorrow you have infection, so you just pick the drugs, and maybe it's even an antibiotics. You just go to pharmacy and buy, and not even know that this time around you have abused antibiotics. And because you have abused antibiotics, there's probability that the fungi will start growing, especially when you have attacked the lactobacilli, which is the normal flora of the vagina. You have abused antibiotics to the point that it has affected the lactobacilli. So what will grow? The candidas will start growing. They will have a favorable environment to multiply, and you start having inches. And you being that you are ignorant and of the fact that these antibiotics would not work for fungi, but your doctor gave you drugs and you have seen the name of the drugs, you just go to one pharmacy and buy, and at the end of the day you keep on making the fungi to grow, the candida to multiply. So what I would advise is that once you notice that you have treated before, but this thing you are still having the symptom, go back to your doctor and they will do a test for you and they will treat you. You understand? So don't do self-medicate. And if you're pregnant, just like I said, and you just feel like, I don't want to, please, I want to, just go to a lab. And if the pregnancy is more than 6 months, you can just do low vaginal swab. Don't worry about high vaginal. Tell them by yourself that you want, and you are a virgin too. You are scared that somebody might be virgin in the process of taking a sample. Tell them to do low vaginal swab for you. And at times also, when they do this test, you are having itching and they do this test for you, it might come out no growth. So if you see no growth in your result, that does not mean that you don't have bacterial infection, because there is what is called bacterial vaginosis. Vaginosis is when the normal bacteria in your vagina is like it's like a kind of battle. They are the normal bacteria and the abnormal bacteria. They are there. They are kind of fighting for space, or let me put it like that. You understand? So you also feel these symptoms. So when they do this test, there might be possibility that there won't be growth, but you see after the culture, they might say you did no growth, but in the comments of it, they might say that vaginosis, that vaginosis. So when they say vaginosis like that, that's why you also need to see your doctor, because you reading this, you just say no growth. These lab people, they don't even know what they're doing. They say no growth, I'm feeling symptom, but on the comment they already told you that it's vaginosis. So that's why you need to see a doctor. And when they say results, okay, no growth, vaginosis, they are still giving you drug. Like, but they said you did no growth. When they say you did no growth, does not mean that you don't have infection. Just that the bacteria did not grow in that media, and the comments section of it is telling you that it's vaginosis. So you don't even have maybe candidiasis, but it's vaginosis, which is bacteria. It might be a normal bacteria that is multiplying. We don't know why it is multiplying, because even though it's a normal bacteria, if it is more than the rain that is in the vagina, it's occupying two space, you might still also feel the symptoms. So that's why. So another thing that could also, if you're pregnant and you're also having itching, it could also be you're having cholestasis. when there is a blockage in bile duct, you know, the bile helps us to emulsify fats in our body. So if there is a blockage in the liver and the bile, they are not able to, you know, pass through the process to go and do their work of emulsifying fat, and they become too much in the body, and so the person begins to build up bilirubin. So this person, especially during pregnancy, the person will be having inches. All your body will be inching you. So it's also, that's why I'm also advising that you should see a doctor, because once they check, maybe they check these things, you're having inching. The inching could be in your vagina, it could be anywhere. And they're saying there is no vaginal infection, they can ask you to go for liver function test. You understand? So that's all. So it's not a thing to be scared about. Now I also want to talk about the care of the vagina. As a virgin, how do you care for your vagina if you are a virgin? And most of them are always scared of being, you know, doing some things that maybe will affect their state and all that. So what you should do, you can use cold water. You can use cold water. So when I mean cold water, not ice blocked water, like cold water to wash your vagina. Just, you don't really need to put your fingers deep. You can just use to wash it out. And you can also, if you want to use steam, make sure that it's a mild steam, and you just do it like you sit on it. You take yourself up. Don't just sit on it for too long. But steam pressure is usually advisable for those that just put to bed, or women that after their pregnancy, that during postpartum, they can use steam pressure to treat any whatever they're having in the vagina. They can use steam pressure to treat that. You understand? That's it just for infection, to minimize the inching. Actually, it's not if they have infection. You understand? You could be pregnant and you have STD. You might still have it while you are pregnant. You still have it before pregnancy. So at times, not really because of the effect of the hormone. So even if you have STD before pregnancy and you get pregnant, so it means that it's going to get worsened. You understand? Because you have it now, and the hormonal changes and all that is also still affecting. So it means it's going to aggravate the symptoms that you'll be having. So you have more discharge, you have more inching, and lots of them. You understand? So the best thing is for you to treat them, because it could also affect your baby, especially if it's syphilis that you are having. So it would affect your baby. You understand? So that's another thing, is that if you are noticing that maybe you're feeling like pain, maybe especially after you have put to birth, you are feeling pains in your vagina, I think you should see a doctor. It is not a bad thing that after postpartum you can see your doctor for another vaginal examination. So there's no big deal in it. That in Nigeria, most people after pregnancy, they don't even go, after putting to birth, they don't even go to hospital again. They don't even pay. But the truth is that you still need to go back for a checkup and everything. So if you are not subscribed, please do so, because in the next video I'll be talking about breast pain and nipple pain. So if you have not subscribed, do so, and also leave your comments down below.